Start.
Respected chairperson and my judges here, the topic is outcome of upper or lower lid retraction correction by novel FP in Graves' orbitopathy. No financial interest. In thyroid disease, second most target is orbit. Chronic inflammatory disease, autoimmune origin, females are most commonly infected. TAO, 77% are affected, 3% hypothyroid, euthyroid, and lid retraction mostly commonly finding. In early stage, this is retraction corrected by overactivity of the sympathetic overactivity, and the latter stage is fibrosis. The condition may be vision obscured due to exposure keratopathy and hamper the quality of life. So, to evaluate the study, to aim of the study, to evaluate the functional cosmetic outcome of upper lower lid retraction using novel filamentous knitted polyester fabric as a spacer material to appraise the safety, efficacy, and durability of the filamentous knitted polyester fabric. So inclusion criteria, all the patients with thyroid eye disease having upper or lower lid retraction, minimum sclera, so 2 mm, limited proptosis, less than 2 mm retraction due to any cause, euthyroid. Exclusion criteria, huge proptosis, more than 20 mm, significant squint, restriction ocular movement, TED, thyroid malignancy, skin disorder like Stevens and any infection of the skin. So evaluation parameter, pre and post-operative photographs, pre and post-operative LPS action, pre-body MRD1, MRD2 value evaluation, palpebral fissure height, pre and post-operative eyelid closure, patient satisfaction. In upper lid, the shape of the spacer material 26 to 28 meter length, central wide depends upon the moderate ptosis, that is induced moderate ptosis, that is limbus to distance is 5 mm, amount of sclera also added plus extra 3 mm. This is the formula we use. And in the lower lid is 20 to 20 meters central wide, 6 meters central wide, which is fixed and rounded border. So the parameter, pre-operative proportion, MRD1 value 6.212 with standard deviation of 4.1, MRD2 value 7 standard deviation with 4.57, PFH values 14 standard deviation of 10.03 with standard deviation. Pre-operative LPS action is 18.42 to 12.92. Pre-operative mean scleration upper lid is 2.82 to post-operative almost nil, and the pre-operative scleration in the lower lid is almost pre-operative 3.1 to post-operative this is almost nil. So comes to the video. This is the lid retraction. Now, what is seen, the upper lid crease incision made. We detach the central LPS muscle and Muller's muscle, partly dissection, partly recession, and thrown back distally. And the new novel filamentous knitted polyester fabric used as a spacer material to hold the LPS for reattachment of the LPS to the tarsal plate. In the lower lid conjunctival approach, we detach the inferior retractor from the tarsal plate and create a semilunar space where the filamentous knitted polyester fabric as a spacer material and the conjunctiva deposited all over the tarsal plate and kept for 3 days. Reverse. This is the beneficiary of the patient in our study. So various spacer material use autogenous facilitator, bank sclera, orbital septum. This is not satisfactory. In 1919, Courtney first used a 93% success rate with full thickness blepharotomy. Hutchison and Hurlix, they are doing a 95% success rate. Musicids and spasm is a 32% success rate. In our study, we did 94.7% success rate. What enable 8 turnover orbital septum, their success is 80%. So use of spacer material orbital septum lengthening the levator appendicis muscle may not be possible in all the patient. In our study, FKP is applicable in all the patient. The formula used in Lee et al. Suggests that spacer metal distance dimension 2 into degree of restriction plus 2 mm. We use the formula, what is that? 5 mm. We use moderate ptosis, 5 mm, amount of sclera plus 3 mm extra. That is the central width of the spacer material. And we did a multiple hole over the spacer material. So novel FKP spacer material causes not only the lengthening of lead, it also prevents the reattachment of LPS and inferior to the tarsal plate. We use the 8-0 proline suture, interlocking suture, create a multiple hole FKPP. That's improvement the lead. And bank sclera had a disadvantage. Orbital septum does not vascularize, but result is control. The muscle in space also distinct very not satisfactory. So consequently, FKP is a Good question and friendly material. It is not total extrusion, no. Thickness is 6 millimeter. Fabric is useful. Thank you.
What is your follow-up period?
Follow-up period is 6 months.
They are maintaining.
Yeah, but study is not yet complete. We have just studied, 8 months gone. The result is excellent. And still we are improving our series.
So how are you procuring this?
No, this is hospital supply. Actually, this material used in cardiothoracic surgery.
Okay.
This is a material which used for ventricular septal defect repair.
Okay.
Then when I see that material is used in cardiothoracic, why not is not used in eye? This is the material is flexible. All direction can be flexed and durability is much higher. So, and multiple hole, when you create it, the fixation is good.
And what about the cost?
Cost, madam, it is 3,000, but we did 10 inch by 10 inch square.
So you can use
and
it.
if you 1 inch, then effective cost is 340 rupees per patient. But our hospital, it is almost free.
So how are you measuring the, you said, but I couldn't understand, amount of...
The measurement is, for the upper lid, it is 27 to 28 millimeter. And the central void that we make a formula, induced ptosis, moderate ptosis, that is 5 millimeter.
Okay.
Amount of sclerosis which is measured, then extra 3 millimeter.
Added to it.
Added. The formula used by the other scientists, they are into scleral show plus 2 millimeter extra. But we have used this formula, its result is good.
Okay. It's a good thing. You can try, but...